Okay, thank you everybody. So I'm Amy Laidlaw and I'm here on behalf of Surrey County Council as I work in the team around the school. But today I'm here as a collaborator just with past experience in school leadership, but most importantly, as a passionate advocate for social mobility. So I'm no expert, but I'm certainly passionate on this area. Next slide, please. Okay, so let's jump straight into thinking about the meaning of child poverty. And here I've got a really short, simple meaning. Child poverty means parents can't afford the basics of food, clothing and shelter. And that comes from the Children's Society. And here you've also got another young person's view. And this comes from the Trussell Trust piece of work called Youth Perceptions of Poverty in the UK. And it says, I wore the wrong shoes to school one day. And when I said I didn't have others, the teacher just said, I'm sure your mum can afford a cheap pair of proper shoes from Primark. But no, she can't afford it. And I don't want to ask her when I know she hasn't got the money. Next slide, please. So let's have a think now about the national context of poverty. Here we have some data that's pulled from the Social Metrics Commission. This was published near the back end of last year, and it shows that we've got really high levels of poverty amongst our children here at National Picture. So around 5.2 million children are affected by poverty. And that's around 3 in 10 children. And if you think about it in a school context, in an average classroom of around 30 children, that's about 9 children in every class. So it's a really widespread issue. And unfortunately, the rates of poverty in the UK now are higher than they've been at any other point in the 21st century. In terms of an international picture, recent UNICEF data also shows that the UK has seen the highest rise in child poverty rates amongst all 38 countries who are part of the OECD, which is the Organisation for Economic Cooperation and Development countries. Next slide, please. So let's now think about some of the key characteristics. So poverty is compounded by other systematic inequalities, and it's vital to understand the experience of children and young people in this context. So some children and groups are significantly more likely to experience poverty, including Black and ethnic minority people, migrants and disabled people, or those with caring responsibilities. Also here, it says about the rates of lone parent families have much higher rates of poverty, and the difference is stark. So almost 1 in 2 children in a single parent family live in poverty, compared with 1 in 4 children in 2 parent families. But also it's important, as I said before, to know that many children and families experience multiple disadvantages simultaneously. Next slide, please. So that data set actually mirrors the Surrey context, but let's have a look at some numbers here. So around 8.6% of children in Surrey are growing up in poverty, which is around 20,000 children, or approximately 1 in 12, or around 2 to 3 in every average class of 30. General affluence is higher in Surrey, but disparity is greater. And we've got a picture that could be seen almost to be seen as the haves and the have-nots. We have to also ask ourselves a question, even though the prevalence is lower, does that actually mean that our families are more disadvantaged? Because living in an affluent society could mean that there are greater barriers for people who are in financial hardship. Next slide, please. So here we've got some data around free school meals. Well, while free school meals eligibility is not a direct indicator of childhood poverty, it is a useful reference point in understanding levels of destitution and changes to economic challenges. So here you've got the England, the South East and the Surrey figures, and this is for eligibility of free school meals. But again, you can look further into this picture. And the figure varies greatly in different types of educational settings, with our pupils in state-funded alternative provisions having 62% likelihood of them being eligible for free school meals. There's also a high proportion of children in our special schools who are eligible for free school meals. In addition to that, it's really important to note that even though the eligibility data is here, there's a large gap between those that are eligible and those claiming free school meals in Surrey. So in the year 23-24, the number of children eligible but not claiming was over 5,500. And this could be due to a variety of reasons, including cultural differences, logistics, and potentially stigma that was already mentioned. Some children living in poverty are not eligible for free school meals, however, and that group are really key. They can sometimes get lost, okay? And actually, to think about that in greater depth, it's important to know that this is not an issue just isolated to unemployed households. And around 70% of children living in poverty have at least one parent in paid employment. Next slide, please. Okay, so here we've got some data from SMEF, and you can see the 5 groups with the highest proportion of eligibility for free school meals. So children in Surrey from Gypsy and Roma backgrounds are the only group in the county to have higher rates of means tested free school meals eligibility compared to the rates for that same ethnic group nationally. So that's a really key group for us in Surrey. And interestingly, 65% of people from Gypsy and Irish traveller backgrounds in Surrey have no qualifications, compared to a Surrey average of 13%. So again, that's a big gap. Next slide, please. Okay, so I want to just have a look in a little bit more depth here at another group. And here we're thinking about gender. So you can see here that 60% of universal credit claimants in Surrey are women, with a higher than average proportion of female unemployed claimants in Surrey. We also have a wider median gender pay gap for full-time work, and our rate in Surrey is 14% compared to 8% nationally. Now, this is even more interesting when you think about the earlier educational outcomes. So nationally and locally, girls and young women actually outperform boys across most educational measures. So in the table here, you've got some data from the Key Stage 2 assessments. So you've got around 69% of girls in Surrey achieved the expected standard for reading, writing and maths combined, whereas only 58% of boys achieved that expected standard. And when it comes to the higher standard again, 11% of girls achieve it and only 8% of boys. Girls outperform boys across all ethnicities, but we still see that there's this difference, okay? And again, it's repeated in post-16 education. So I want us to ask ourselves how we can change things in Surrey to support more girls to have a fairer chance at accessing the roles and wages of which they're capable. Next slide, please. Okay, so where we live in Surrey also adds to the disparity. And there are huge regional deprivation differences across the county. So much work has taken place, particularly by public health, to try and understand and improve outcomes in the areas most affected by deprivation. 21 key neighbourhoods have been identified where residents experience worse outcomes across a range of factors, including life expectancy, mental well-being and educational attainment. There are a brilliant set of infographics around our key neighbourhoods, which if you haven't seen already, it's really worth finding and downloading to have a look at, as the data captured in them is tremendously useful. Next slide, please. So, what are the impacts of poverty? Well, there are many, and today I'm just going to focus on a couple in order to do them the justice that they need, but we could talk about this for a really long time. So next slide, please, Deb. So the first thing I'm going to think about here is the attainment gap. So the Sutton Trust reports that by the time children are starting school, there's often already a gap of 11 months between the lowest income children compared to the richer classmates. Children growing up in low-income households can experience delays in aspects of their development. For example, there's income-related differences in children's early language development, which can be evident even by 18 months of age. There are also disparities in accessing early childcare, which is causing inequity from the youngest ages. Now, in the table here, you've got a piece of data again from the Health and Wellbeing Strategy, where actually it's looked at. There's some really interesting data around attainment gaps at different ages. And when you look at it, it compares gaps in different boroughs within Surrey, identifying the best and the worst performing areas in terms of tackling that attainment gap. Next slide, please. So, school absence and participation are another impact of poverty. Financial restraints can lead to school absence due to a variety of factors, including travel to school, children not having the correct resources for school, and not affording to participate in things like school trips and activities, as well as mental health factors. It's essential that within our organisations we consider new policies and practices through a lens of poverty and take account both of the standard costs, but also the wider contextual costs, which may prevent people accessing and participating in our organisations and estates. We already mentioned the Good Company resource, The Cost of the School Day. That's a brilliant place to start. It is a school-based resource, but could even be an interesting thing for somebody to read if you're from a different sector, just to think, okay, just to give you a starting point really about thinking about your finances for your estate. Next slide, please. So physical well-being. At ward level, there is a 10-year difference for males and a 12-year difference for females in terms of life expectancy between the best and the worst wards in Surrey. So where you live and the level of deprivation affecting your community has a huge range of impacts, including life expectancy. Levels of deprivation are also linked to immunisation take-up, dental health, and the prevalence rates of a range of diseases. Now, again, public health are the real experts around this, and there's some really interesting data available on Surrey Eye. Next slide, please. And then in terms of mental health challenges, the Children's Society tell us that children living around debt are 5 times more likely to be unhappy than children from wealthier families. Now, this again is an area that we could talk about for a really long time, but a great place to start is a report that's on screen here, Dual Crisis, the hidden link between poverty and children's mental health. Money and mental health are inextricably linked, and it's really important that we all have a good understanding of how that might be affecting our children in poverty. Next slide, please. So just very quickly, a couple of final thoughts really from me. Let's be humans before professionals here. Children living in poverty aren't a problem that needs solving. The very fact that you're here today, you know that. Each stat represents a human living in a family of people affected by financial hardship. And if we can take an empathetic, compassionate and relational approach, we're more likely to move forwards with this area. If it's predictable, it's preventable. You know, let's think about things when we're changing policies and practices. Let's think about things through a lens of poverty and actually start working a bit further upstream. What can we do to make sure that our families are prepared for situations in advance rather than catching them when they're struggling? And finally, let's talk about this issue. If what's holding you back is confidence, there is some great resources out there to help you feel more empowered to have some conversations around this area. And just one resource that you can pull upon is on the screen here, a practical guide for education staff to help tackle poverty and the cost of the school day. And in there are some really brilliant suggestions in terms of practical ideas that you can do just to get conversations started. And that's it from me. Many thanks.
Thank you so much, Amy. So much data that you have to put your hands on there, and it's a lot to pack into a short time. So well done. Thank you. Right, moving on to Sara from Stripey Stork.
Good morning, everyone. I'm Sara. I'm the operations manager at Stripey Stork. Next slide, please, Deb. The Stripey Stork are a baby bank, and we work across Surrey and Croydon We give out practical items that are needed by families who have children aged 0 to 18 years, and we do that on a referral basis. In the last year, we've helped over 11,500 families, and we have a network of over 1,000 professionals referring to us, all people who are supporting families. What we give out is pre-loved and new items like prams, beds, bedding, toiletries, school uniform, toys and books. All of the children in the families that we help are living in poverty to some degree. Alongside financial stress, families might also be facing mental, physical ill health. Many are affected by domestic abuse. They could be homeless or displaced, might be seeking asylum, and many families have no support network. We don't claim to be experts on child poverty, like Amy said, but I'm here to share some of our experiences. Next slide, please. So this is a quote from a mum that we helped who had moved to Surrey from London. And that points out that there is a general perception of Surrey as a place without poverty. This does not reflect the reality of the families and the children that we help. It's not uncommon for a partner referring a family to us to say, this family has nothing. Being an area with comparatively high living costs, this can drive not just the lowest income families into poverty. We find that many families who are facing hardship don't meet those accepted definitions or thresholds for support. For example, Amy mentioned the families that don't qualify for pupil premium. And this can lead to families who really need help feeling like they shouldn't ask. In areas that are seen to be more affluent, talking about financial stress is harder, it's less normalised, there can be a social stigma, some parents feel a sense of failure. And for children, it's really hard not to compare their lives with the children they see around them in different economic situations. Next slide, please. So poverty affects the way that children feel, how they learn, how they grow and develop, and the relationships that they have. And these are some of the ways in which we've seen poverty impact the children in Surrey that we help. We see a lack of essentials, so the equipment that children need to be safe and warm. We've had requests to help babies who are sleeping in Amazon boxes, on changing mats, or sharing beds with parents and siblings. We hear about parents who don't have a suitable buggy, they can't get the children to school safely, or they can't stay warm and dry in the winter. We hear of children going to school without coats or weather-appropriate clothing. We hear a lot about fuel poverty, families who can't afford to have the heating on, who end up with mouldy and damp environments. Their bedding and mattresses are ruined. They experience health problems, their sleep is affected, and therefore children's concentration at school or nursery. Many families are affected by domestic abuse or potentially financial abuse. If a parent can't afford to leave an abusive relationship, a child may be trapped living in an unsafe environment. We hear about the instability of temporary accommodation. Many families are on long waiting lists for suitable housing, and in the meantime, they're moved around a lot, moved urgently, so children lose links with friends. They might lose the advantage of key supportive relationships they've built with teachers or other adults. They might have a lack of belongings because they exist in small spaces and they never know when they'll have to move on, and they live with uncertainty and change. We hear about food and hygiene poverty, children going to school hungry or with dirty clothes, because families might lack washing facilities. They might not be able to afford a laundrette. They might only have one set school uniform, and children might feel embarrassed at school if anyone notices that their clothes aren't clean. The cost of fresh food might be prohibitive, or they might lack cooking facilities. Next slide, please. We hear of children that have a lack of stimulation. They don't have the essential items that they need to learn, develop and relax. And we do hear a lot about school poverty. We know that in the UK, the average cost per year of a secondary school uniform is £422, £287 for a primary school uniform. And this cost is on top of the cost of transport, devices for homework, stationery, period products, coats, lunches, school trips, and all the other things children need to get through the school day. A lack of these essentials can have a direct impact on children's confidence, their relationships at school, and of course, their learning. We know that children in poverty lose out on participating in everyday life. When there isn't enough money for bills and food, there's nothing spare for anything else. We hear about children who might not have a present on their birthday. They might be the only one at school without a Christmas jumper on, or they might have to turn down party invitations because they don't have a party dress. These losses all affect their social interactions, their sense of belonging, and their confidence. Then there is the stigma of poverty itself. This affects parents a lot. It's hard to feel that you can't provide for your children, and they might fear that their parenting will be judged because of their financial circumstances. And poor mental health, which is both a cause and effect of poverty, and this can affect both children and parents and carers. For children, living in poverty can contribute to anxiety, low mood, feelings of isolation. For parents with poor mental health, they may struggle to access support, and that might lead to a more complex situation in the long run and a delay in getting help. Next slide, please. This is a quote from a mum that we helped, and I'm just going to tell you a little bit more about her situation. Lisa and her children became homeless after the death of her partner left her with no income. She wasn't able to afford her privately rented home anymore, so she's waiting for suitable council housing. She has 2 young children and one of them is in nappies. They're frequently moved between hotels where there are rooms available. They have been moved out of the county occasionally, as 2 councils disagree about who should be responsible for housing them. What little money the family do have does not last long. With no cooking or washing facilities, Lisa's forced to buy more expensive convenience food. She worries for the health of her children. They're still growing, developing, and they don't have many toys or much space to play. Often with no money left and the universal credit not due for a few days, Lisa still needs to buy food and nappies. She's borrowed from friends a lot. She feels guilty. She doesn't like to ask for too much help. But she worries a lot. One of her children is due to start school soon, so there will be uniform needed. Christmas is just a few months away, and the baby will soon grow out of their clothes and their coat again. She has an understanding support worker who checks in with her regularly, and through her she's been able to access clothes, nappies, toiletries and food parcels. The support worker refers her to services and collects things for her to make life easier. Lisa worries that she will be moved out of area again, and then she will not be able to access that support. Next slide, please. This story really highlights how children who are living in poverty need support at many points through their lives and how complex poverty can be. Lisa's family were affected by all of the following. And solving all these problems at once would be really impossible for Lisa, and the weight of trying to keep up with it all would be overwhelming. Supportive relationships with professionals would be the key for Lisa to her beginning to climb out of poverty. Next slide, please. Which brings us on to what we can do. So these are some of the things that we've observed that can help. So working together, raising awareness of the support that is available, knowing what's out there in terms of practical and financial support for families and how to access it, thinking about where you can make warm referrals. So rather than just signposting, can you refer a family into a service where they will contact the family, make it easier for them? And how can we work together as organisations to create spaces and communities where families already feel comfortable, places they can go where they can get multiple types of support under one roof? It's good to talk about it, normalising needing help, talking about money issues, trying to use the language that the person in question is comfortable using to describe their financial situation so they're more likely to open up. Not waiting to be asked by somebody in poverty, but offering your help. And talking to your staff and your teams about poverty awareness and some of the things that we've been talking about today. Help them recognise when people are struggling and know how to speak to them confidently and sensitively about their situations. Next slide, please. It's really important to show understanding when talking to a person who may be experiencing poverty. Think about the language that we use when we're talking in general. Look at our comms. How are we talking about children in poverty? Are we challenging misconceptions? Are we accidentally presenting negative stereotypes? See each person individually, know their name, treat them as an individual. Be supportive around issues with poverty, even if that's not your main reason for working with families. And create hope. Show children and families that you can see them and that you care about them. Next slide, please. One of the things that Stripey Stork have been doing is learning more about the power of participation and how to keep families at the heart of everything we do, our true north. So we got involved with the Poverty Truth Commission in 2023 and 2024, which is a national initiative involving people with lived experience of poverty in the design of services that are aimed at supporting them. The commission in East Surrey was run by Good Company, who we've already mentioned, and involved users of the Epsom Food Bank, Stripey, Stork, and other local services. It also involved agencies like us who wanted to understand that experience and help improve their services. Being part of this commission helped us to understand how it feels for someone accessing our service and how hard and often scary it is to ask for help. We learned that poverty is rarely just one issue. If family needs our support, they're also likely to need support with debt, with energy, with housing, etc. It's really exhausting to manage all these situations at once, and getting a referral takes time and energy. So we try to give as much support as we can first time. We also learned that small changes can have big impacts. Something as simple as making your referral criteria simpler, changing a form. It's important to provide continuity of care so that somebody can speak to the same person each time they contact you, build trust, and help the family not have to tell their story over and over again. Next slide, please. I hope sharing some of our insights into supporting children in poverty has been useful. Please feel free to get in touch with any questions, and I know that there are some more useful links and resources to be shared later. If you are working with a child whose family could benefit from a referral to us, please don't hesitate to get in touch with Stripey Stork. And if you are interested in training your team in poverty awareness or finding out more about the work of the Good Company, there is a link there to that as well. Thank you.
Thank you so much, Sarah. I think that was such an important mix of hearing about all of the challenges, but also some of the more hopeful stuff at the end about how we can respond to those challenges. So thank you for sharing your experiences. Okay, we're not taking really any breaks at this point because I'm keen to hear all of the amazing content we've got from the three people, and then there's a time to breathe and go into breakout rooms after this. So but feel free to keep popping your reflections and everything in the chat. We're loving reading them, so carry on doing that. So I'm going to hand over now to Anna from Transform Housing. She's a service manager at Pound House in Woking. Hey Anna, are you there?
Hello everybody. Thank you for having me. Yes, as the first slide says, my name's Anna. I'm the service manager at Pound House. Next slide, please. As you can see there, Pound House is a 12-bed hostel for 16 to 21-year-olds. We also have 2 emergency beds, which are ones that Surrey County Council can drop people into if they have nowhere else to go for the night, as long as they are between 16 and 21 and meet their criteria. We're quite short term, particularly the emergency beds. So as it says last year, last year we housed 26 young people. We also have 3 shared houses for 18 to 21-year-olds when they're sort of ready to take that step up into independence. Next slide, please. Sorry, that looks a bit small from here, but that's just to give you an idea of the age range that we look after. We've seen quite a big increase in our 16, 17-year-olds, so children. A lot of this due to the fact that Ofsted is starting to look at the supported accommodation sector. One of the reasons for that is that some of it's quite poor, which means a lot of providers have closed down or moved into the older age group because of the complexity of Ofsted. So we are seeing a larger number of children. Our referrals come, as I said, via Surrey County Council. They have the Gateway team. They have a system called Care Place, where they send all young people out to all providers, and then the providers have to get back and say whether they can offer a room or a bed to a young person. It's not the most targeted of systems, but it's the best that they've come up with so far. We also take referrals from the local councils as well, and we can take anyone from any borough council in Surrey. And yes, our emergency beds. It can be a night, it can be a fortnight. We've also had people now for sort of 3 or 4 years who started off in an emergency bed. If the location works for them, then we're happy for them to stay. Next slide, please. To just give you a little idea of the background of the young people we look after, as you can see, most of them are care experienced. So they may have come out of children's homes or foster care, and they are looking for sort of the next step up in independence. Asked to leave by parents last year, also 23-24, which was one. This is a growing area for us. Mainly young men asked to leave home by their parents. Quite a few unaccompanied asylum-seeking children who come to us, and people who've been referred for mental health or by youth justice. We have quite a few young people on tags generally, and we had one person who was literally homeless, but in order to meet our referral criteria, they have nowhere else to go. Next slide, please. Right, so now we get to it. The problem. Our clients, particularly the care experience, are under huge pressure to be in employment, education or training. They have child looked after reviews, they have personal education meetings, and every time they see their social worker or personal advisor or have key work with us, we are talking about how important it is to get a job. Most have dropped out of formal education by the time they come to us. They generally lack qualifications, having had a patchy at best school engagement. Very few can provide the passes in English and maths, which an employer is looking for. And even fewer actually want to return to education. The training opportunities, obviously there's the whole NEET, not in education, employment or training. There are very few training opportunities for young people. There are lots of very fancy looking apprenticeships, but you need quite a lot of GCSE passes for those. And they also have a not great impact on any benefits they're receiving as well. We've had care leavers who've done apprenticeships who've lost all their housing benefits, although this is apparently something they're entitled to. That hasn't filtered down to the local councils. When they're under 18, they get what's called the independent living allowance, which is just over £70. It matches the rate of universal credit. And then twice a year, they get a clothing allowance of £150. Now, these children, this is their only money. They generally come from families who do not have the money to help them out anymore, or they have no family in this country. Most of them really want to work. They want more money. They want to go out, they want to buy clothes, they want to learn to drive. Social services, if you are in care, will pay for 4 lessons if you pay for the other 4. So lessons at the moment around sort of £25-30 an hour. That's quite a lot of money when you get £70 a week, and that's got to pay for everything you have. So under 18, their full housing cost is met by the council. So they can earn pretty much what they like, but it's not actually that easy to find a job when you're under 18 now. They don't have parents asking their friends about opportunities, making sure they've got interview-ready clothes, and they may not have the sort of pro-social skills because no one has modelled them. They also lack resilience. If they get turned down, it can be really difficult to pick them back up again. In an ideal world, the young person will get maybe a Saturday job, as we used to have in the old days. And they'll have fixed hours that keep them below the threshold where they lose universal credit when they turn 18. And then they will then move out of supported accommodation, which is very expensive, into shared private rented, and immediately go into a full-time job that meets all their needs in a neat and timely manner, having consistently saved around half their wages. Next slide. This doesn't happen. They start a job. It's generally a 0 hours contract. They are pressured to do more hours. They think they will lose the job if they say no, so they agree. And who doesn't want more money? Immediately their housing benefits suspended. So they become liable for full rent and their arrears start to build up. Our rent, to give you an idea, at the moment is just under £300 a week, and we are one of the cheaper supported housing providers. So you're looking about £1,200 a month, which maybe a room in a shared house in Woking at the moment is probably about £800, bills included. So that is a step up from that. And rents sort of vary massively. So we've shown them the benefit calculator. We've pleaded with them to save at least half their wages while we wait for the council to recalculate their benefit. And we also plead for their wage slips, so we can supply them to the council. They may not want to give them, not understanding that actually HMRC already knows how much they earned and has told the council, which is why the housing benefit was suspended. The council, despite knowing how much the young person has earned, will still not reconsider the award unless payslips and UC statements are sent. It is an awful circle. You can say the same thing over and over again, but unfortunately for this cohort, adults are not to be trusted. People who look and sound like us with ID badges around their necks have been in and out of their lives for years. They've fought for everything. We've expected them to have independent skills wildly beyond their years. 16-year-olds in our hostel shop and cook for themselves. They do their own laundry and they buy their detergent. Their rooms are inspected once a week and are expected to be clean and tidy. We tell them that the way to be productive and useful member of society is to get a job, and then we demand half their money. It's also worth adding they are difficult to work with. It can be immensely frustrating to have the same conversation over and over again. We're not mental health professionals, but we're expected to deal with a huge variety of mental health and learning issues. We're given boundaries training, but our clients are skilled manipulators and sometimes they break through. As a manager, I expect all clients to get the same support and get the same respect, but we're only human. You can only call someone a C word so many times before they don't want to help you. Next slide, please. Oh. Right. This is an example of a young person who we have been working with for some time. He came to us through the criminal justice system. He did everything he needed to do. Very good independent skills, very good at paying his weekly personal service charge. We moved him to one of our outside houses. He's very, very keen to work. He does have family, but they do not have space for him to live with them, and they cannot support him in any way financially. He's been trying very hard to get a job. He will do anything. He finally managed to get one just at the end of last year, 6 weeks. It was a demolition job, and he earned £2,000 and then spent it. At every stage of our support with him, we have made it very clear that once you start earning, and because of the work that he can do, he can actually earn quite a big daily wage immediately. We repeatedly said, save half your wages just in case, because we don't really know what the housing benefit is going to be until housing benefit tell us. You can use all the calculators you want, but it's never so particularly precise. So we can't say to someone, I can tell you now, if you earn this much, you will have to pay this much. So he earned his £2,000 and basically spent it. And this is a quote from his WhatsApp to me, as I'm his support worker. I'm hugely sympathetic, but he's currently bidding for council properties, and most councils won't consider you if you have rent arrears. So we now have a young person who's in £1,500 of rent arrears, who needs to move on. He is capable of work, and he can't afford to live in supported housing while he works. Next slide, please. This is another area for us, our unaccompanied asylum-seeking children. Many of them are under huge pressure to send money home. They've often had their journey funded by family or someone the family now owes, in the expectation that they will start a new life, earn lots of money, and support their families. Before they get their status, they're not allowed to work, but their families are desperate, so they often find cash in hand work through their community. This will put their status at risk. Once they have their status, they can work, but it can be very, very hard, because nothing obviously matters more to them than their family. They have been through, in almost all cases, an incredibly traumatic journey. In some cases, just something the rest of us could not imagine, particularly when they've travelled as children. They have seen awful things. It's often taken between 6 months and a year to actually get here. And all the time they are just driven to help their loved ones at home. This particular client, who we've been working with for around a year, worked while he was under 18. He had status. His was quite a clear-cut case. It came through quite quickly. So he was fine, he was allowed to do that, and he could keep all his money because he was under 18. And he sent a lot of money back home. He's got an uncle looking after his 2 younger siblings. His plan is that he would like his siblings to come over here with him. So he needs to move out as soon as he can. He's a very bright lad. He has stayed at college. He's doing very well. He's doing courses that we generally wouldn't expect a former unaccompanied asylum-seeking child to be doing. He works very hard at college, and last year he decided to take a summer job, and he earned quite a lot of money. He didn't keep us informed of how much he was earning, despite us asking. In the end, his support worker actually went to his employer and said, you need to give us this information or he's going to be evicted. And they did, which was very kind of them, with his consent. And he was constantly told to try and keep his hours down. He's now in arrears of £2,137.40. This job ended at the beginning of September. He's already paid us back £2,000, so it was a lot worse before. He is very keen to move on, but as I said before, Guildford Council won't let him bid until his arrears are cleared. So he's now got to pay that back, and he's not working because he's realised what happens when you work. You lose your housing benefit, which unhelpful. Next slide, please. As you can probably tell from my unhinged rambling, I don't have any answers. I think from the earlier speakers, this is what happens at the end. When all those issues haven't been addressed, you end up with these young people. If we could fix the education system, it never ceases to amaze me that we live in this very affluent part of the world, and yet we constantly see young people leaving schools in Surrey without any qualifications. That cannot be right. Lots of people have said lots of things. When I was sort of trying to do some research on this, I was looking to see if anyone else had come up with a magic solution. Schools are under immense pressure at the moment. There's no argument around that. There's been talk of adding a requirement to UC that they almost provide someone with a qualification, or you get less money unless you're studying to try and get that qualification. But actually, people should be leaving school with some kind of qualification. And most of Surrey's young people have an amazing cushion of support. I think there could be voluntary work, and your UC could depend on that, just to get people in the sort of in the way of working, and that you don't just get money for nothing. At the moment, our clients are better off if they sit in their bedrooms all day gaming than they are if they go out to work. And they stay below the poverty threshold, which is awful. My children have 0-hours jobs and they can do what they like with the money. Sometimes they don't get much work, they don't have much money. Other times they may have hundreds of pounds. I'm not charging them rent. I supported them through school to get the qualifications they needed to get proper jobs. And if and when they get those, they'll move on. But they will still have the bank of mum and dad behind them. But the children and young people I work with are so vulnerable. They have no support network other than people who are basically paid to care. They live with deep ongoing trauma. In a lot of cases, the support networks, a lot of them are lucky. They have got social workers, another professional. They've got their PAs when they turn 18, another professional. They've got us if they're in supported housing. They may have mental health support, but where is their cushion? And I would be very grateful to hear from anyone who has any answers, and we will implement them. Thank you very much for your time.